Because it seems to me, what I observe is people are more concerned about, cognitive impairment, dementia, Alzheimer's dementia than even having a heart attack. Like, I think it's on the front of people's minds even more. And so if you're looking at things like that, NAD is top of the list for people to engage in prophylactically or preventatively, that they could start even when they're 30. Like, we've never, ever, and I mean never, ever have seen where someone gets too much NAD.
Hello, and welcome back to the Vibrant Wellness Podcast. I'm your host, Dr. Emmie Brown, joined by my co-host, Melissa Gentile. Today, we're absolutely thrilled to have Dr. Craig Koniver join us. In this episode, we'll delve into the future of longevity, NAD therapy, peptides, and top longevity tips. Dr. Koniver will share his insights on how these innovative treatments are revolutionizing the field of anti-aging and performance medicine. So whether you're looking to optimize your health span or explore the latest advancements in longevity science, this conversation promises to be both enlightening and empowering. Dr. Koniver, thank you so much for being here. How are you doing today?
I'm good. Thank you guys for inviting me to be here.
Yeah. Absolutely.
We're super excited for today's episode, and I just want to start us off with a really hot topic of NAD. So what is NAD and why does it matter so much for longevity?
Yeah, so NAD is nicotinamide adenine dinucleotide. So it is a coenzyme that's used all over our body in every cell. I think of it as the rate-limiting substrate that our mitochondria uses to eventually make ATP energy. And so if we look back, we've been fortunate at our practice to have been using NAD longer than most, almost about 10 years now, using intravenous NAD, and then also, in patients doing at-home injections of NAD. But a lot of that has come forth with a lot of published research over the last, 10 years, certainly 5 years, focused on the role of the mitochondria in both, disease, right? So I think it's, well implicated that the mitochondria is the source for things like heart disease, cancer, neurodegenerative disease, autoimmune disease, but also on the wellness side, right? So we, what I tell people is we don't just have one mitochondria per cell in our body. We have thousands of mitochondria. And then, even more than that in certain cell types and, organ systems. So our mitochondria are super important, and NAD seems to be, you could argue, is it the most important nutrient in the mitochondria? Maybe. But what we know is, both anecdotally and then published research, as we get older, as we stress out our bodies, it's harder and harder to keep up with NAD demands. And so using this nutrient, which is a chemical cousin of niacin, vitamin B3, we're, making great, strides and progress in helping people live their best life.
And what about NAD supplementation? So I know you just mentioned IVs or injection, but is it also effective through like an oral route?
Yeah, we found, NAD is not well absorbed orally. So that's why people are using, kind of oral NAD precursors like NR, NMN, which are going to trigger, the production of more NAD. What we found, though, is the very best is NAD itself. And so we're very biased. I'm very biased in that, but that comes from observing, thousands upon thousands upon thousands of patients who we've utilized NAD with, mostly intravenously, but certainly kind of subcutaneously at-home injections. By and large, the vast majority of people get, transformational results. It's a transformational experience to their nervous system. People come back and uniformly say their brain is getting bigger. They feel more creative. Colors look brighter. Languaging is easier. They're sleeping less, but have more energy. Their mood is enhanced, on and on and on. And so it's very real, the benefits that people experience with NAD.
I can definitely attest to that. I've had NAD treatments here and there, but I haven't been consistent with it. But kind of everything that you're saying, it's almost like an immediate feeling, like an immediate rush. Definitely sets you up for kind of the best day ever. So how often do you recommend with these NAD treatments that people do them to stay? Are they staying consistent? Do they have to come in every week? Is it more something where you're doing it more often in the beginning and then you can kind of space those treatments out?
Yeah, what we found is, again, somewhat through trial and error, that we wanted to do a loading dose. So we think the loading dose, we're talking about intravenous therapy, a loading dose, and again, through our kind of own internal testing, we like a dose of 750 milligrams. We found that's the sweet spot. The original NAD protocol, where they're using NAD intravenously in Mexico, which was where it kind of grew from, where they're using it for substance abuse, right? People going down to Mexico for issues with pain medicine, with, opiates, with alcohol. They were using 3,000 milligrams, which is a massive, massive dose. And that's why I was taking 6, 8, 10 hours per treatment. And when we first started using it, I realized no one's going to come back for day 2 if they've been in my office for 8 hours. So no one has time for that.
Not
and
feasible.
So we did a lot of testing and found, again, I'm not saying it's perfect, but what we found is 750 milligrams of sweet spot. Most people can get through that treatment hour and a half, which is much more reasonable, and still get the same benefits. So we found a loading dose of 5 treatments in 10 days, kind of sets the table. And then after that, on average, people will come back for one, maintenance treatment of 1 IV per month. So I think that's pretty reasonable. Now we have people doing it more frequently. Some people are going to do it once a week. Some people are going to do it less frequently, right? Some people are going to do it once a quarter. Everyone's a little bit different. But we found that the loading dose plus maintenance is where it's at, for sure.
And who's a good candidate? I mean, this really sounds like it's something everyone would want if we're focusing on longevity, but who's a good candidate? Are there any contraindications?
Yeah, I mean, the 3 contraindications that we use, pregnant women, because we don't like to give pregnant women anything, and then patients with congestive heart failure or chronic kidney disease, not because of the NAD, but because we put the NAD in 500 cc's of saline, and the fluid requirement for that is too much. So outside of that, we have not found a contraindication, meaning no medicine, no other diagnosis. Very, very, very safe. It's an uncomfortable treatment, particularly the IV therapy. Most everyone gets some sort of stomach cramping, chest pressure. They feel agitated. Sinus gets congested. Legs feel heavy. But it's doable. And people work their way through it. And I think some of that has to do with what's happening at the level of the mitochondria, which is called mitochondrial fission, which is the hallmark of, I think, NAD therapy, is we're cleaning up the cell. So we're making those defective mitochondrial DNA, kind of getting rid of them. And then that's the first part of the loading dose. As we move into the 4th or 5th treatment, now we enter into something called mitochondrial fusion, where we're taking those same mitochondria, putting them together to make them more efficient, to make even more ATP. And that's when people really, the lights turn on, people feel better, have more energy. They're so glad they did it, and they want to keep that going.
Do the therapies, the sessions rather, get easier as they keep going, or is we always going to have those kind of adverse effects?
Yeah, I don't think they're going to get easier, but psychologically they're easier because people know what to expect. So that first treatment's really, that's the worst for most people. We just have people take their time. Now during the pandemic, obviously less people were doing in-office treatments. So we shifted. We're still doing a lot of intravenous NAD, but doing at-home kind of, subcutaneous injections of NAD, which seemed to work well. It's just going to string it out. We use a dose usually of 100 milligrams per injection, and an injection frequency of inject Monday through Friday, take the weekends off. And that's a good kind of frequency and kind of protocol.
Got it. All good information. I love the specifics. I'd love to learn more about the brain refuel program. This is your approach. I mean, it sounds like you just kind of laid it out. Are there any more specifics in terms of the brain refuel program that we need to know about?
Yeah, I mean, so what we found is that, using NAD and then combining it, we use a vitamin blend. It's actually vitamins, minerals, and amino acids after the NAD. We don't ever mix anything with the NAD. We like to keep it totally separate. And then we use this vitamin, mineral, amino acid blend after that we give intravenously. And that kind of, once we started doing this again years ago, we were getting even better results than just NAD by itself, which makes sense because we're using B vitamins, we're using magnesium, certain amino acids that help with the, what we call redox in the cell, in the mitochondria. So it's kind of supercharging that process.
Nice. And I'm wondering, you mentioned cognitive decline being addressed here. Are you seeing Alzheimer's patients? Are you seeing good outcomes, overall neurodegenerative conditions?
So it's hard, right? So if we think practically of why would or when would a patient with neurodegenerative disease come see someone like me, or probably the host of functional medicine, alternative medicine clinics across the country, it's likely after they've been diagnosed and tried conventional therapy, right? So it's usually not at the onset of the diagnosis. It's usually several years into the diagnosis.
Mm-hmm.
So while I think therapies like NAD can be helpful for neurodegenerative disease, I think it's really challenging because it's usually years that the disease has integrated into that person's system. It's very hard to undo these things, right? Like it's almost impossible. So while we'll offer NAD and we'll counsel the patient, and I think it's helpful, we also have to level set expectations that if you're a patient or a family member, the goal can't be that all of a sudden, take some NAD and all of a sudden things are back to normal.
Of course.
That's totally unrealistic. And I think there's a lot of clinics, for better or for worse, who don't understand that probably. And they're like, oh yeah, we'll do NAD, we'll fix your Alzheimer's. And that's just not the case.
Right. Set the expectation. Also, so glad that we have you on to educate, because maybe if we're looking at mild cognitive impairment, we can intervene earlier,
For sure.
and maybe see better outcomes in those cases. So I appreciate that.
Yeah. It's a great point. I mean, I think for people looking for because it seems what I observe is people are more concerned about, cognitive impairment, dementia, Alzheimer's dementia than even having a heart attack. I think it's on the front of people's minds even more. And so if you're looking at things like that, NAD is top of the list for people to engage in prophylactically or preventatively, that they could start even when they're 30. We've never, ever, and I mean never, ever have seen where someone gets too much NAD.
Even in younger individuals, would you recommend still doing the same kind of dosage? If someone's in their early 20s?
Yeah. So the challenge is if someone's in their early 20s and we've done this, they do a loading dose of NAD. Well, if they're healthy and fit, they may not feel it as much. So then they're going to be like, I didn't experience anything. So they're like, oh, you want me to pay money to continue? Well, we think it's good for you. It's harder for them to wrap their mind around. Now, I would still argue someone who's 25 is going to set themselves up in an amazing way doing NAD across the decades of their life. But again, it's harder for them to wrap their minds around. So, but I think it's at the top of the list for, that things like methylene blue, again, works at the level of the mitochondria to help, our nervous system, work more efficiently and provide a cognitive boost. I mean, there's other things, peptides, lots of other things people can do. But, people should know there's tons of options for this.
Dr. Koniver, obviously you've been doing this for so long. You're an expert. You gave us specific dosing. And for listeners out there, I would not be surprised if they're already sold and they're trying to find a provider who can provide this to them. What are some red flags? I'm sure, because so many clinics are just jumping on the bandwagon. So I want listeners to understand what to look for.
I mean, that's a really good question, right? I think questions, if I'm a prospective patient, that I would want to know, how long have they been utilizing NAD? What's their protocol? Do they have a loading dose? And then, depending on what's the cost, right? Because there's a lot of price gouging going on, right? I mean, a couple of years ago in Los Angeles, people were charging $3,000 for one NAD treatment. I mean, that's very, very high. Again, all for people making as much money as possible, but it needs to be reasonable, right? Mm-hmm. So, we're way more reasonable. We charge $550 per treatment, right? And that's probably less than the national average, but we're going to keep it reasonable because it again, still very expensive, but we want to make it reasonable because we really believe in it. So if you're a prospective patient, I mean, we have patients who fly in to see us to do just this because
I'm sure.
Yeah, because they just want the experience and they also want it to be reasonable. But that's not an option for everybody. But I think if I'm a prospective patient, how long have they been using it? What dosage do they use? What's their protocol? We've trained a lot of the practices around the country years past. So yeah.
That's super helpful. And I would hope that those practices are displaying that, proudly, so that it's easily identified, because if I'm a patient, I'm going to want to see that. And it doesn't seem like there is a lot of regulation when it comes to, IV therapy and so many clinics popping up. So
I think there's more and more regulation, I think from the States, and there's certainly more and more regulation. Some of it, good and needed, and some of it probably goes too far, but, I agree with you. I've been, in this space a long time, and you see a lot of clinics just pop up, offering things like IV therapy or hormone replacement, and they don't necessarily know what they're doing.
So let's move on. I think peptides is such a hot topic right now, and you gave us the rundown on NAD IV therapy, so that's a good one. But peptides overall, I think a lot of even practitioners, if they're not in this niche kind of longevity space, they may not be aware of how peptides work, right? They are probably at the very least aware of GLP-1. That's probably the hottest peptide right now.
Yeah.
The public is aware of this, but overall, what do peptides do? How do they work? And what are they used for?
Yeah, I mean, peptides, like you said, the GLP-1s are peptides. So peptides are just chains of amino acids put together in novel combinations. And then, when we first started using peptides, I broke it down. There was peptides for fitness, right? Peptides for inflammation. And there's a very short list. Now, in the last 10 years, that's blossomed. I mean, there's so many peptides. So there's peptides for inflammation, peptides for immune system, peptides for skin, peptides for wound healing, on and on and on. So it can be confusing. By and large, the peptides are super, super safe. So by definition, they're 40 amino acids or less in size. So they're small molecules. So we think of them as cell signaling molecules. There's peptides that trigger growth hormone release. There's peptides that are potently anti-inflammatory. There's peptides that modulate an immune system that's not behaving appropriately. There's peptides for DNA repair. Again, on and on and on. And there's just a lot of peptides. And what I really like about them, first and foremost, is very, very safe. It's very rare to see a side effect with a peptide. Now, there's some known that do some of the growth hormone releasing peptides do cause some side effects, but again, it's still rare. So as people think about, should I use a peptide? I think it makes a lot of sense. Like if you want to perform your best in whatever you're doing in your life, I think the older model is I'm going to make sure I take these nutrients like vitamin D and probiotics and fish oil, which may be well and good, but most people don't feel anything from those. Like you're not going to feel much different from taking this supplement. Most people doing a peptide injection over a couple of weeks will feel it. There's an enhancement to their sleep, enhancement to their performance, enhancement to their workout. They lean out, they look better, they feel better. So it's more of a modern way to approach, kind of turbocharging someone's health and performance.
A lot to love there for sure. And what I heard, maybe reading between the lines, you mentioned an immune system that's maybe not behaving the way we want it to be. Are we using peptides in autoimmune cases?
For sure. Yeah. Oh yeah, 100%. Like for example, thymosin alpha 1, I think is the best peptide for an autoimmune kind of condition, right? So I think most people are familiar with the immune system, kind of running surveillance, making sure that there's no outside invaders coming in like germs, bacteria, viruses, parasites. But another massive role of our immune system is to make sure that it clears out dead cells and dead tissue. We have cell turnover all the time. And an autoimmune disease, by definition, is it's attacking live tissue. So something like thymosin alpha 1 or thymolin, we use that as well, helps an immune system kind of regulate itself. So it's not, autoimmune is overactive. So it kind of tempers that overactive component. And so it's not as, active or severe, which we've seen lots of great things, reduction of inflammatory markers in the lab. You see the C-reactive protein go down, you see homocysteine go down. It's very, very real. And then people feel it. They're backed up by how they feel.
Have you had experience with conventional rheumatologists, and what do they think about peptides, if so?
I'm not sure. I mean, I have some rheumatologists who are patients, and they're well versed.
Sure.
I would probably venture a guess that, like most other doctors who are conventionally trained, they don't know much about it, and they see it as voodoo, which is unfortunate. So,
yeah. Well, and I think that I just like to put out there that thank goodness we have IFM certification, and I think a lot of conventional providers are aware of IFM. So I'm always just thinking about specialists who have training, whether it's IFM or another reputable functional medicine training, in case we really need those specialists on board to coordinate care. And it's something that I think about, and I talk to providers all the time to, tap into your resources, find those providers who are open-minded, because it really takes a village sometimes for these complex cases.
I agree. And the other problem with a lot of doctors, to be totally honest, is they don't like to work together. Right? There's a lot of territorial things going on.
Yes.
It's so stupid to me, but
gatekeeping.
Yeah, it's my patient. No, we can all help each other and keep our egos at bay and help the patient where they need help. and it doesn't have to be territorial.
Yes, absolutely. Such a good message.
Yeah, that's a really good point. Dr. Koniver, what are some other key peptides to know, or ones that you're using most often in your practice?
Yeah, so we use one that's called pentadecaarginate, which we shorten it to PDA. That's the new BPC. A lot of people are familiar with BPC, which was body protection compound, BPC 157. The FDA pulled that in October of 2023, along with probably 10 to 15 other tried and true peptides. It's a big step backwards for all of us in this arena, both patients and providers, because these were amazing peptides, safe, getting great results. Now we can't use them. But the PDA is only one amino acid different than BPC. So it's actually really good. We're actually seeing super fast responses to inflammation. So if people have any musculoskeletal issues, that patients with ankle problems, knee problems, shoulder problems, and they start the PDA and they come back usually within 4 to 7 days saying they feel much better. So it's very anti-inflammatory. We use a lot of that. We're using some of the growth hormone releasing peptides. There's different ones like ipamorelin, semirelin, tesamorelin. They kind of have different flavors. Those peptides, when injected, will travel up to the pituitary and help your pituitary pulse out growth hormone, which is a very anabolic hormone. And as we get older, we make less and less growth hormone. So that's a very popular one as well.
Mm. And with these, again, I know I asked this with the NAD, is this something that you have to be cyclical with, or is this something you take indefinitely, or are you pulsing certain peptides and then pulling back? Is there a dependency that can happen?
The way the schedule that we created is 5 days on, 2 days off. I think, I tell patients to do that with their oral supplements as well, because I think anytime you expose yourself to the same thing over and over, you render it less effective. So it's important to build breaks into the cycle. I don't think there's a dependency. I do think there's a cumulative effect with peptides. So as people use peptides, we like them to run the same peptides for 3 months straight and then kind of pause and say, how am I doing? If they like how they're feeling and they're getting good results, keep continuing. Or maybe they say, I'm sick of injecting myself, take a break. Or maybe they say, I want to work on something else. You could try a different peptide. In general, once people start peptides, they really like how they feel. There's an up-leveling kind of across the board in terms of, just things work easily in the body. There's better cell signaling, meaning brain fog goes away, they lose weight, they become more, resilient, all these things that are very positive for people.
And you may have said this already, but if you could choose just one, what are you really loving right now as far as a peptide for longevity? Say you have someone coming in, they say, well, I feel pretty good. I don't have any past medical history. I don't have any complaints, but I want to, up level or really optimize. If you had to just pick one, which peptide would it be?
I think probably that PDA, because so many people are dealing with inflammation somewhere, whether it's systemic inflammation from autoimmune disease or, just orthopedic musculoskeletal complaints. Or you can make the case that people who work out regularly are inflamed, right? That's part of the process for getting fit. And so PDA really does a nice job. It's not going to downregulate your own, needed, hormetic response, but it is going to help prevent, tendon injuries and ligament injuries, things like that.
Help you get back to, maybe not having so much recovery in between high intensity workouts. Totally. I imagine that's super beneficial.
Yeah, I agree.
And can you share a transformation that you've seen using peptide therapy? Maybe a case study or a patient you've had?
I'm just thinking, I have a patient, he's here in Charleston. He was, I think he's in his late 50s. He exercises regularly, and he kind of feels beat up. He had a lot of foot and ankle pain, and started him on the PDA, and he came back and said 3 days later he had no more foot and ankle pain.
Oh, that quickly? Literally. Just 3 days?
Yeah, 3 days, and that's very common. I spoke to someone yesterday. She came up here from Florida, and she said same thing. She has fibromyalgia, and she said within a week her fibromyalgia pain was all gone.
Amazing. Oh, and that's a tough one, fibro.
Super tough. Yeah. Mm-hmm.
Very cool. What about stacks? What are stacks?
Peptide stacks?
Yeah.
Yeah. And so what we do is we like to put peptides together, which is a little non-conventional because most people are going to use one peptide at a time. And that's how when we started, again, but we've been doing this longer than most, it was one peptide, see how people respond. And then we saw that wow, just like, supplements or nutraceuticals, you can stack them together and they work together to elevate the response. And so that's what we do with peptides by and large is we individualize, there's certain kind of generalized stacks that we've seen work really well, but then we can also individualize for people. You're working on this goal. Let's take this peptide plus this peptide plus that peptide and put them together and make it work as well.
So I imagine, are they pulling this up into the same syringe, or are they separate injections?
So, by and large, we work with a pharmacy. All peptides we use are compounded, and they're all patient specific, and they're all blended together.
Ah, nice.
Yeah, and so it makes it from a compliance standpoint, as opposed to patients doing 3 shots a day or sometimes more, they can just do 1 because the peptides are compounded together.
Got it. That makes it a lot more convenient.
It does.
And speaking of stacks, and that's just for peptides, what about combining NAD, IV therapy, and peptides? I imagine, people have programs where maybe they're doing both, depending on where they're at in their journey.
Yeah. I think for providers, you can accelerate a patient's response if you're doing some in-office therapy like NAD, and then the patient is using peptides at home, right? Because if you just imagine they're just in your office, whatever, 1 day a month doing NAD, or 1 day a week, or whatever it is, well, they're at home every day. And so if they can do treatments at home, they're going to supplement with the IVs they're doing in your office. And that's how you kind of turbocharge people getting better faster.
Dr. Koniver, I do want to pivot a little bit into longevity tips. Most of our audience is providers, but we do also have a little bit of a patient base that's probably listening in today. And I think we all kind of want to focus a bit on longevity nowadays. So what are some strategies for optimizing health span do you recommend to listeners who are probably already prioritizing their health, but they want to take it to the next level? Now, this doesn't necessarily have to be like a supplement or a device or a service in office. It could be something like a lifestyle factor or a way of eating. Just anything that you think you would want to give to somebody who's already a pretty healthy individual, but they just want to take it a little bit further.
Yeah, I tend to be contrarian on this issue, so take it for what it's worth.
Oh, we love that.
Yeah, I'm not a huge fan of this longevity anti-aging movement because I think it's made up, right? How does anyone know what your life's going to be like in 10 years, 20 years, 30 years? It's impossible, right? And we also know that there's never a destination. You can't live your life saying, well, if in 5 years, if I do this, I'll be there. It never works that way. So the way I think about it, it's just directional change. So the best way to lead a long life that's healthy is focus literally on a very healthy day, and then do that again and again and again and again. Now you've strung together 5 amazing days. Now it's 7 days. Now it's a week. Now it's a month. That's all you need to do. You don't need to complicate this by, we'll take care of this now to prevent something later. I think that is completely made up. And I know that that's become popular, in the podcasting world, and a lot of these doctors and, health influencers saying, do all these things now to protect yourself or promote, health span, lifespan later on. It's very hard for me to conceptualize that. It's much easier to work with the patient and say, what are your goals right now? Work on those. And guess what? Once you meet those goals, you're going to have different goals. And then you're going to change direction and want to work on that. And then, I think, if you're looking for I think there are some key components, right? I think we overvalue the nutrients we think we need, right? So people should eat less. That makes sense. We undervalue how much we think we need to move. So people should move more. I'm not trying to make this stupid easy, but sometimes you have to, because people know what to do, but they just don't do it because I think they're waiting for something to be a little bit more complicated. Where the reality is if you get up, see the sunrise, live with the sun, kind of eat less, move more. Obviously, we can fill in the gaps with, amazing tools like NAD peptides, certain nutrients, bioidentical hormones. We're big fans of checking your labs on a regular basis, which is really what's going on the inside. I think you have to be balanced. And I think that I see being talked about a lot is not balanced. It's all about doing more. It's all additive, right? It's high intensity exercise, restrictive eating patterns, right? Sauna, cold plunge, where does it end?
Yeah, this is actually something that we've talked about a lot. And I'm really happy you just brought up this point, because I think we sometimes go to extremes with devices and therapies and all these, really extravagant things, which are awesome. And we just talked about a few. When we talked about peptides, we talked about NAD, and how these things can be so healing and effective for people. But at the end of the day, we can't outweigh our lifestyle if we don't have the foundations, like you said, rising with the sun, moving enough, eating a little bit less, really going back to the foundations. It's like we really are trying to overcomplicate just being a healthy human.
I totally agree with that. Yeah, that's well said.
It's refreshing to hear that coming from a doc who's doing IV NAD and peptides also. So as you said, it's maybe a little contrary to what we'd expect you'd say. I mean, that's what we love. We like to keep things fresh on here.
Well, I think it's hard, and it's hard for providers, right? Like providers are trying to just do the best for patients.
Of course.
And, a lot of providers getting into this space, the wellness space. One, because it's very positive and you can really make an impact. Not that disease-focused medicine can't be. But, I think patients as a whole are sick and tired of the very conventional healthcare system that doesn't listen to them, doesn't validate them, doesn't pay attention to them, and just, kind of sloughs them off and gives them lots of pharmaceuticals. And that doesn't feel good to the patient. I think that doesn't feel good to the provider either, right? So that's why we see a lot of providers getting into the space. But I think you just have to be careful as a provider that you're not promoting, something that's going to be too stressful. At the end of the day, what I believe is that people, most of the change, if you want to lead the best life, you got to work on your mindset, right? It's learning how to pivot from stressful, negative things to be super positive. And that's not talked about enough, right? Like people talk about what's your cholesterol, what's your grip strength. And I think if you're 85, living your best life, you literally could care less about this.
Yeah, it's such an important and profound message there. And again, I'm so pleasantly surprised a little bit to hear that coming from you. I didn't know much about your background, and as far as the practice you have, I think that's extremely important to mention. It's really another foundational piece. And I'm curious, Dr. Koniver, do you have an in-house counselor, health coach? Are you referring out to psych as needed? I think this component is so important.
No, I mean, not we can, but I mean, this is what we like doing. And the philosophy that we practice is different, right? So the philosophy that I adhere to is I want to help the patient feel better first, right? So if you look at conventional medicine, it's always about get the diagnosis. And at the end of the day, no one cares about how the patient feels, but that's what the patient cares about most.
Right.
So these tools that we're talking about, NAD and peptides and hormones and all this, they're bridges to just help patients, experience how they want to feel anyway. And I fully believe all of us have everything we need inside of us, right? They say all healing is self-healing. Everyone wants to have a seat at the table of their healing experience. But most doctors and most providers don't empower patients to do that. They disempower them by saying, hey, take these 3 drugs, come back in 3 months, we'll do this. We'll manage
it's an
this.
algorithm.
Yeah, it's that's not what people want, right? And that's why people are collecting doctors now, because they're not being listened to. And so the only way it works is when patients trust their providers. And the only way they're going to trust them is if they get small wins, right? And that's why NAD is an amazing therapy. That's why we've done so well, is because when someone goes through an NAD loading dose, they're literally going to change your perspective on the world you live in. And when that happens, the light bulb's going to go off and you're going to be like, this feels better. I want more of that. So I'm going to listen to the provider who helped me with that. And so then from my side, then we can dig in and start asking the deeper and larger questions to really start peeling back those layers to understand, what is the struggle? Because we all have struggles. We all have curveballs thrown at us. But that's the essence, right, of life, is then figuring out how to navigate that, not living there, but pivoting to this very positive place where you can be of service to others. And that's where it gets really good. But none of that is possible if you just say, hey, take this Prozac and come back. I'll give you 5 minutes more time to take more Prozac. There's no value there.
Well, this took a turn. It wasn't on the outline, but it's extremely important for this topic as kind of an underlying theme for keeping people feeling well. Even though, some of these therapies we talked about are quick acting, it sounds like in many cases, which is amazing, but we really want to sustain them with these foundations also. So thank you for that.
Sure.
And I do want to circle back a little bit and talk about functional medicine labs. So of course we have our routine labs. We want to be up to date on those, but are you using functional medicine labs? Are you using stool testing? Are you using organic acids? I'm kind of curious. You use these to complement the therapies we've talked about?
Yeah, I mean, I think where we start with our patients is we're going to use Vibrant America Lab as serum testing, blood testing, right? I mean, this is my philosophy for what it's worth. I break it down to like step one is what makes you, right? And so what makes you are things like vitamins, minerals, hormones, right? That's what makes people up. That's what we want to work on first because that has the most influence on how someone feels day to day. And then we want to extend that, like what makes you work. And then we're going to start looking at systems, right? We're going to look at your liver detoxification system, your adrenal system, right? Your mitochondria, which I think the best test for the mitochondria is the organic acids for sure. Mm-hmm. And there's good testing that organic acid for, looking at the liver system. For the adrenals, we like to do saliva testing, and then more like 24-hour urine to look at, these hormone metabolites. Sure. But, the panel that we have a male panel and a female panel that we use with Vibrant America that we really start with every patient, right? It's going to be the routine stuff, CMP, CBC. We're going to look at full thyroid hormones, all the hormones. We're going to look at vitamins, minerals, inflammatory markers, lipids, metabolic markers. It gives us a really good kind of screen to say, here's what's going on the inside. So here's a good starting point.
And that's your custom panel for your practice, right?
Yeah, and we do that pretty much with everyone. That's how we start. We love how Vibrant America displays the results. They're in color. People can track progress. There's so many variables you can test, and we can change that, right? Like if an ANA turns positive for whatever reason, or a CRP is really high, we may want to do, like we just started using the autoimmune, zoomer. Like this is great. We use the gut zoomer. We want to really expand where we need to expand, but our baseline is starting with what kind of I described, and it's a really good panel. And then Vibrant has done amazing in the last couple of years with turnaround time. It used to be 2 weeks. Now, I check, we can get most of the results back in 48 hours.
Yeah, we're proud of that.
Yeah, no, it's awesome. It's really a nice upgrade. And if a provider's listening, they're not using Vibrant, and you guys offer, by the way, there's no affiliation. You guys haven't offered me any money or anything. I just want to declare that I owe you nothing besides I choose to use you because you offer a great service. And so
thank you.
Be very clear on that. But I think you offer a breadth of testing that I haven't seen with other labs.
Yes, we have a test menu that's very, very robust and one we're proud of. So thank you so much for that. We appreciate it.
Yeah.
We're coming up on the time here, Dr. Koniver, and this has been jam-packed with pearls so far. And we touched on this a little bit, but I really want to emphasize, maybe for listeners out there who they may feel like, how do I even get started in this space? I'm intrigued, but I don't know where to get started. You mentioned trainings that your practice provides. Are you still providing those trainings? And can you tell us a little bit about that?
Yeah, I've been doing training practices and providers for years and years. I enjoy it. I like being of help. I started my practice in 2006. It was a, traditional primary care practice, but I also, for whatever reason, incorporated nutritional IVs. And so I've been doing this a long time, longer than most, but I've learned a lot. I didn't have anyone helping me per se, so I had to make a lot of mistakes. And so it's really meaningful for me to help other providers, whether they're, new in this space or they've been doing it and they just want some help. We're just an open book, and we have different, ways we can help them, from one-on-one to groups to, video courses, all kinds of things. That just, it's important for people to seek out mentors and get help, because it's hard to know, particularly with all of AI and the deep fakes, like what's real and what's not real.
Oh, yeah.
You know what I mean? Yeah. And so, again, we talked about patients needing someone to listen to them. Well, providers need that same kind of personable touch as well. It's very hard, right? Like I just know, being a provider, it's very easy to burn out. Like you're absorbing energy all day long, day after day after day. And if you don't have an outlet for that or a way to diffuse that, it'll catch up with you.
Mm-hmm. Yeah, absolutely. We need each other. We need mentors, like you said. We need to talk about kind of maybe our difficult cases and and collaborate. That's hugely important.
Yeah, and I find that in the functional space, if we collectively say that, the providers there are way more open, way more critical thinking than conventional medicine doctors who are very much streamlined. Seems like they have blinders on. They just want to write prescriptions. Not that prescriptions are bad, but they don't even entertain other options, right? Like if you look at the humans and how humans have healed themselves over time, millennial, prescriptions and pharmaceuticals are very new in this arena, right? With nutrition and fitness and acupuncture and chiropractor, all these modalities are time tested and they work very well. And I think the key for a provider, if you really want to have success, is learn how to individualize your care over each patient. Stop playing the generic game that most providers play.
That's
Dr.
the art of
Koniver.
it all.
Yeah, it is. And it's taken away, right? Like the whole humanity aspect has been taken away. And it's going that way. Like if you're a provider, a new provider, you need to know that in short order, you're going to be replaced by AI, probably within the next 5 to 10 years, if you don't figure out how to relate to people and build relationships.
Yeah,
It's
maintain
coming.
that humanity. That's going to be a big one. I mean, it is already. It's amazing how rapidly things are changing with AI. And yeah, that's a whole nother conversation. But I'm glad that you touched on it because it's something we need to keep in the forefront of all of our minds.
Totally. Yeah.
Well, Dr. Koniver, this episode was so amazing. Like I'm really happy you got into NAD and peptides, but even more so your philosophy, and even sharing the different resources that you have available for providers. So if anyone tuning in is a provider and they want to connect with you or they want to check out some of your resources, where can we find you online?
Yeah, on our website, koniverwellness.com. I mean, it's going to clearly delineate if you're a provider and you can enter in information. We'll get you information. That's the best place. We're on Instagram, although not a lot. But it's really important for me that we practice what we preach. So I will always see patients every day. I want to be in the trenches. This is how we learn. This is what we enjoy. And this is really where the meaning is, whether it's me helping providers or me helping patients. There's no better place for me to be.
We're going to drop the links below for you guys. You can find Dr. Koniver's website and his Instagram online. He's been on many other large podcasts, so go check him out. He's a great resource for you guys. And again, thank you so much for taking the time to be on the podcast today. And until next time, wishing us all vibrant health and wellness.
Thank you guys very much.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. And just a reminder, this podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guests and hosts are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.